Hi, everyone. Welcome to another episode of Active Aging. My name is Danielle Procopio, and I'm your host. I'm very excited to introduce you to a new service that's available in our area, Heyday Health. And we have a very familiar face to Armstrong joining us today, Mr. Bill Adams. Bill, welcome back to Youngstown. Thanks for joining us on the show.
Hi, nice to be here.
And we're very excited to hear about what you've been up to with Heyday with Dr. Mehta. Dr. Mehta, thanks for joining us today.
No, it's my pleasure.
Of course, if you could both just take a minute and tell us what your role is with Heyday, it would be great. And then we can start talking about the great services that you are offering.
Great. Well, I'll kick us off. My name is Nupur Mehta, Dr. Nupur Mehta. I'm the co-founder and chief medical officer for Heyday Health.
Perfect.
And I'm Bill Adams. I'm the brand new community outreach coordinator for Heyday Health as of 2 weeks ago. A long time Valley resident.
Perfect. So Dr. Mehta, we're so excited to hear a little bit more about Heyday Health. Can you tell us what Heyday is? What can we expect to hear about and see from Heyday Health?
Yeah, thank you. I'm so excited to be telling your audience about Heyday. Heyday is a in-home and virtual primary care practice that's specifically dedicated to the needs of older adults. So let me break those down because I think they're all pretty important. I was a primary care doctor for many, many years, and I was running a series of clinics around the country. And the pandemic, as we all know, sort of turned the world on its head. And pretty much overnight, I had to shut down all of my clinics and move our care, especially for older adults, into a virtual world. Now, what I was surprised to find after having done that is that not only did people were okay with this, many of them did better. And I was thinking to myself, why would that be the case? And what I realized was that folks really, at the end of the day, want access and accessibility to their care team. And by being at home and having a team that was sort of available to them at the push of a button, they were actually able to increase the amount of time they got to spend with their team. And so that was really the genesis of us thinking about launching Heyday Health. We recognize, of course, that video or virtual care by itself is insufficient. And so we start all of our patients off with a very comprehensive house call where we visit folks in their home. We do a full medical visit like you might get at your doctor's office. We are able to prescribe medicines. We're able to do all the lab work and send referrals out. So really changing the way we deliver care from an office-based practice to now shifting it into the home. And some of your viewers might remember back in the day when the doctor used to make house calls, and Heyday Health is bringing that back.
I love that. So much of the world has changed as a result of the pandemic. There were so many changes that we saw throughout that initially started out as something pretty terrible, but we've seen a lot of silver linings. And so it's great to hear that specifically in healthcare, you found the silver lining in a way to easily connect with our seniors. And it sounds like in some ways in a much more effective way of kind of bringing things back to how we used to do them. So talk me through, what does this look like? If I'm interested in services, like what should I expect from Heyday?
Yeah, that's a wonderful question. So when you join our team, the first thing that's really important to know is that you get 3 people. Now that's a little bit unusual, but when you join Heyday, you get a doctor, a nurse practitioner, and a special role that we call the health ally. Think about the health ally as a care navigator, someone to really help hold the hand of the patient and their family as they help navigate the care system or a complicated healthcare system. Now, when you become a patient, that team stays the same. You always get to see the same people, and all 3 of us, or all 3 of the folks on that team, really get to know the patients and really get to know their families. As I mentioned, we start all of our patients off with a comprehensive house call. That's an opportunity for us to get to know you. It's an opportunity for you to get to know us. It's an opportunity for us to meet your dog, but it's also an opportunity to really understand what's your real life situation like, right? And really get a good understanding of the patient, not just from a clinical perspective, but as a whole person, and understanding their really, their lived experience. After that, we transition our patients by and large to a virtual model. So that could be like how we're talking now, which is always our preference. If we can see people on video, we can tell if you're doing well, if you're not doing well, if you're happy, or if you're unhappy. It also enables us to say, like, look at a rash if we need to see something over video. But if video doesn't work for you, we can also make it work over phone. We also have a very simple and easy to use patient portal, which enables patients or their families, if they're okay with that, to communicate with their care team, to request refills, very basic tasks that really make it easy for patients and their families to connect with the team that they're looking for or they're trying to reach. I think what's super important to note, though, is that if for some reason the patient needs us to come back, because we're right here in the Mahoning Valley, we can come back, right? We always have the ability to come back to the home anytime if our patients need us. And when I say that we are available to our patients, we really mean it, 24/7, in whatever way works for patients, anytime, anywhere.
Mm-hmm. And I love that you have a virtual option. We hear so much more about like the virtual options. Today when we call and we schedule our doctor's appointments, there's always that question now that was never a question in the past of, are you interested in a virtual visit? And I have to be honest, I am usually very leery of the virtual visit. I struggle with knowing like, how is my provider going to be able to do as comprehensive as a visit with me, via technology, as opposed to me being in the office and him being able to lay hands on me and listen to my heart and all those things that we're used to from a physician visit. So can we talk a little bit about that, Dr. Mehta? Like what as a provider, tell me a little bit about what that experience is like and why I shouldn't be so afraid to opt into that virtual visit.
Yes, and I understand that point of view for sure. And to be honest with you, before the pandemic and before launching this practice, I probably would have been skeptical too. I think the first thing to note is that, look, we start all of our interactions with that face-to-face visit. So that is an opportunity, of course, to lay hands. That's an opportunity to really understand how your baseline might be, right? So that when we see you later, we can compare before to after. I think the other thing that's super important to note, well, maybe two other things to note. One is that we collect vital signs the same way that you'd collect vital signs in a doctor's office. So if we use a blood pressure cuff, we use a thermometer, we use a scale, we use an oxygen monitor. If patients have those available to them, of course, continue to use them because if it's working for you, continue to use something that works. Now, if there's something that is out of whack and we really want to monitor you more closely, the nice thing about being a Heyday patient is we'll actually provide that for you. And we can, we'll teach you how to use it. We'll make sure that it works well for you, and such that when we talk to you the next time, we can ask you, hey, what was your weight today? Hey, what was your oxygen level? So that we can compare from before and after. I think the final thing I'll just say is, I've been surprised at how much and how well we're able to care for people just by having a good look at them. Because at the end of the day, the art of medicine is just about is just as much about using your eyes and talking to individuals than it is, putting a stethoscope on somebody. And we can get the vast majority of what we need from an interaction like this. But again, if we really need to go look at something, or if we really feel like it would make a benefit or make a difference to doing that exam, again, we will be more than happy to come back, and we should do that, right? Because we need to get the right information to treat our patients.
Absolutely. And I think there's so many positives to this. Again, during the pandemic, we saw our seniors started using technology, at a much higher rate, and they've become much more comfortable with FaceTime and Facebook and, utilizing some of those options that are out there. And when I worked with seniors, I cannot tell you how many times we had to cancel a doctor's appointment because someone wasn't feeling, well enough to leave, or the weather was bad and they were worried about falling. Here we are, Northeast Ohio, that's a big issue. So to know that this resolves some of those issues, and, once your staff comes out and does that initial assessment, and I'm sure acclimates them to the technology that they're going to be using, just to think how much easier it is now to see my provider, as opposed to have to get up, get dressed, feel well enough to make the trip, to get in the car, to call for transport. There's a lot of benefits there for seniors that are looking for that. Also, I know you mentioned that, we don't get as much time with our providers as we used to, and so to know that the care team is that readily available, and that I'd be able to have that relationship with a provider, they know my dog, they know my cat, they've been in my house. I think that really would bring a whole new level to care. So even though it's in a little bit of a different, mode than maybe what we're used to, it sounds like there's a lot of advantages there.
Yeah, I was just going to point out too that in the time I've been talking to people, they've been very happy to not have to go to a doctor's office, especially when you think about sitting in the doctor's office.
Mm-hmm.
Well, again, with COVID, I mean, people are very leery of being around other folks, not knowing if they're sick or not. And again, just from personal experience, I never really enjoyed sitting around, for a while, and then going into another office and sitting around for a while. I mean, here, you have control of your time better too.
Absolutely. So let's talk a little bit about who is actually eligible for these services. I know, Dr. Mehta, you said Mahoning Valley. That means a lot of things to a lot of people. So can we talk a little bit about your service area, what types of patients you're looking for, maybe like how we would pay for this. So if I'm interested, like, how do I know if I'm the right fit for you?
Yeah, no, great question. So our practice is designed around older adults. But to be more specific, we're designed around folks who are on Medicare. So basically, if you're on Medicare, you're eligible. That also includes folks who are dual eligible, if folks are familiar with that. So we basically take all the plans that are in our area. What's amazing, or what's exciting about our practice, is that all of these services are at no additional cost. And that's been a bit of a change in how Medicare reimburses physician services, but all of this, in-home and virtual care is at no additional cost. So whatever you are paying for your typical doctor's office, that's all you'll pay with us. It's exactly the same. In terms of our service area, the good news for us, at least, is it's growing, which is wonderful. We started out in Mahoning, Trumbull, and Columbiana counties, covering all three of those. And as of 2022, we've also sort of expanded westward to Stark, Summit, and Portage counties. So we're covering a pretty big 6-county area right now.
I love it. So you are busy. You are very, very busy. So in that first visit where you're coming out to those counties, what providers are coming out to the home? Is it the entire care team that's coming to see me, or is it just my physician?
No, that's a very good point. We want you to meet the whole care team to the extent that you can. We try to make sure that the health ally actually is the person that really is 100% there, because that's really the main point of contact for patients and their families and us. In addition, we would bring a clinician. So that's generally speaking, the nurse practitioner, and sometimes it's the doctor. The good news, though, is that we are then able to Zoom the third person in. We don't want to bombard folks with, a whole slew of people in their house. So some folks have smaller places and, might not have enough room for 3 additional people in their home. And so just to make it more convenient, we try to bring the third person in via video.
Perfect. Now I have a couple of of transactional questions. So again, as someone who's worked with seniors, I have had the pleasure of trying to transition them to a new doctor or get them hooked up to a new service. And I have some questions about what that looks like. So if our viewers at home are interested in learning more about the services or trying them out, Bill, like, what do they need to do? How do we get them connected to you? What does that process look like? Talk me through it.
Yeah, basically the main number to call if they're interested in more, talking to someone is 330-223-7001. But they can also go to www.heyday.com, and it's it's a great website to get information about exactly what we do, give you an idea of this. Well, there's photos and bios of the whole care team, so you get to meet the folks ahead of time. My role is basically I'm going to be going out to the places we both know, senior housing, senior centers, just any place in the community that is looking to learn about something new in the area. Glad to come out, whether it's again a Rotary Club or something like that, but really looking forward to connecting people with Heyday so that they can learn more. They're welcome to just sort of try it out. I mean, give a call, find out if it's something they're interested in, and then really there's nothing to lose, because if they're again they're covered under Medicare with the insurance. It's similar to if they went to any other primary care physician.
Fantastic.
And just a small correction, it's heydayhealth.com, www.heydayhealth.com.
Oh, did I leave that out? I'm sorry.
No problem, Bill. Not a problem.
That's okay. Well, we will find you. We will find you on the web and we will get you called up. Is there anything that I need to do with my current healthcare provider, or maybe I don't have a healthcare provider? Like, do you need records or anything from that office, or does your team take care of all of that?
Yeah, that's the good news. We try to make it as simple as possible, and we will try to coordinate all of that on your behalf. And we don't want you to have to jump through a bunch of hoops to make it work. And as Bill mentioned, give us a call if you're interested just about hearing more, and we can walk you through all of this. We have very friendly people on the other line who will explain everything in detail. If we will be happy to get all your records. Some folks ask, what if, are you going to become my doctor now? And the answer is, that's our preference, is to become, your doctor if you would trust us with your care. And then the reason for that is really because we believe that we really want to help people, and the ability to help people, the best way to help people is to really become that quarterback of care, and being able to direct people to the right treatments, to the right medications, to the right therapies, so that they can be as healthy and happy as possible. And so, yes, the preference is to become the doctor, but we can work with folks if they have other arrangements in mind. And again, we can explain everything, when folks call or reach out or, check the website.
Perfect. I'm so excited to hear that you're taking new patients, because so often these services become available and they fill up very quickly, and then there's a wait list. So for any audience members at home that are thinking this sounds like a good idea, please call, because you'll be able to get on and learn a little bit more. I do have a couple of questions that I thought of when we were talking through the referral process. Are there any restrictions, Dr. Mehta, to where a patient can be seen? So do I have to live at home? Am I able to be in an assisted living, a skilled nursing facility? Where I live affect whether or not I have access to services?
We try to make it as absolutely convenient as possible. And so, yes, we will see folks when and where they are. There are some minor exclusions to that. For example, if we are not credentialed in a facility, like in a long-term care facility or a long-term care hospital, then we wouldn't be able to see patients there. But for the vast majority of folks, if they choose us to become the doctor, then we can see them.
Perfect. How about a hospital visit? What happens when I go to the hospital? Is your staff currently working with any of the systems, or are you just partnering with the staff there at the hospital?
Yeah, we are an independent practice. And so far, we do not have admitting privileges directly to the hospitals. But the great news is that we have relationships with all of the hospitals. And so wherever you, end up going, be it a St. Joe's or Trumbull or St. E's, or Salem Regional, we are able to connect our team to the clinicians that are in the hospital, because we really care about making sure not only that we're communicating the clinical needs of our patients when they go in, but almost as important, when they leave the hospital, that we're able to pick up the thread and make sure that we keep people healthy and so that they can stay out of the hospital or don't go back to the hospital, God forbid.
Absolutely. And one of the people on the team that you mentioned, I'm betting is a big part of that transition and, in and out of the hospital and just making sure that, I'm doing what I need to do to stay healthy. I want to learn a little bit more about the Health Ally. It sounds like the Health Ally is that MVP on the team that's going to be more your day-to-day contact. Talk to me a little bit about how often I can expect to hear from him or her. What are the responsibilities of the Health Ally? What should I expect? A lot of times what I found is that, sometimes when we have those services, we have a misunderstanding maybe of like the frequency of how often we can reach out to these folks, or exactly what those services are that are provided. So talk me through what the relationship with the Health Ally is going to look like.
Yeah, no, absolutely. Frankly, as it coming inbound to us, meaning you calling us, there's no restriction. You can call us anytime, and we'll be happy to try and address your needs. So there's no restriction there. It's not like there's a limit to how often you can reach us. If you need us, we'll be there for you. Now, on the flip side, meaning how frequently might we be reaching out to you, a little bit, of course, depends on your needs and sort of what's going on in your care. If you're not doing well, or we have a bunch of coordination that we need to work out with you, or we're trying to get you set up with, I don't know, an appointment for some sort of procedure, and we need to give you updates on the timing of that, then yes, the Health Ally would be reaching out to you more frequently. And then, of course, if it were to be a situation where, hey, I would really like to speak to you once a month, and let's just put it on the calendar, and I can be sure that, once a month that someone's going to be reaching out to me, we can make that work too. So like I said, whatever works for patients, whatever works for their families, whatever makes sense for the needs of the individual, that's what we'll try to accommodate.
Perfect. And I think, oh, sorry, go ahead.
I was just going to add that I got a chance to actually go out on a patient visit, and Madison is a Health Ally here locally. And I got to see, she interacts along with other staff, with the patient. And she's going to be the person that, can find out, things on medications or home health programs that you might, just programs that you might be available to you. So it's really a key, I think, position in the team, and she's really good at what she does. I mean, based on what I saw.
That's good to
hear.
Definitely,
and very, very good at her job.
I think that for seniors, just navigating the healthcare system is, well, for anyone, I shouldn't even just say for seniors, because for all of us at this point, navigating the healthcare system has become very overwhelming. And so to know that there's going to be someone to help coordinate prescriptions and making those appointments and following up if I need physical therapy or home health or hospice or, whatever might be kind of coming down the pipe for me from a healthcare perspective, that can be very overwhelming to try to navigate on your own. So I love hearing that Health Ally is there to kind of champion that experience and that journey and kind of walk alongside the patient. But where does the family fit into all this? So, for those loved ones that are the caregivers, talk to me a little bit about what their role is, if at all, in this care team.
So critical that we talk about families and caregivers. Philosophically at Heyday, we actually think of the family and caregiver as part of our team. And so if the patient, of course, agrees, right? The patient has to tell us that it's okay to include their loved ones. We're happy to include those folks in the care of the patient themselves. And I think what's one, sort of very beautiful thing is that let's say you don't live in the same geography as your mom or dad or brother, sister, or child. Historically, you weren't able to be a part of the care of your loved one. But now with sort of the technology that we're using right now, in fact, you can bring them in regardless of where they are. So let's say, the patient's in Youngstown and the son is in Denver. Well, we can bring that son in to every interaction in a really meaningful way, and they get to see what we see. I think at the end of the day, what we recognize is that patients do a lot better when they have the support and reinforcement of people who care about them. Because to your point, it can be overwhelming to manage health conditions, and to the extent that we can tell the message or tell the care instructions to the patient, but also have another person to help reinforce that, it just makes it that much more likely that the good things are going to happen.
Absolutely. And I think that's one of my favorite things about your service is that, we love Youngstown and Northeast Ohio and Western Pennsylvania, but we do know a lot of children of our seniors have left the area, whether it's for jobs or better weather or whatever it might be. And so to know that there is a way that they can be a part of the visit and hear what the care team is saying to mom or dad or, aunt or uncle, firsthand, rather than trying to get that translated version afterwards, I think is such a valuable service that you're providing. So I think that, that brings a lot of value to the table for family in general, let alone, loved ones that are out of town that are trying to manage care from afar, because that can be very difficult. So I appreciate that brings that to the table. It's great. So I have one more question. I know I'm full of questions today, and I apologize. I know we are providing primary care mainly, Dr. Mehta. So in the event that I am managing a chronic or acute illness and a specialist needs to be brought into my care, how will that work? Obviously you're not going to have control over that specialist visit, but are you still going to be a part of that conversation?
Yes, and that's absolutely how we want to be sort of coordinating the care. I sort of mentioned, the quarterbacks being a quarterback. And so when we throw the ball to the wide receiver, we want to make sure that they catch the ball and that, when they, run in for the touchdown, that they hand the ball back to us. And so that we can close the loop on as to what's happening with the patient and what their recommendations are, because if it does indeed require a specialist, we also want to know what the specialist is recommending so we can reinforce that with the patient. And so very important when we refer to specialists that, we're continuing to be kept in the loop. And look, I would not be, I would be lying to say that we can manage everything ourselves. But what I can say is that we will do our level best to make sure that everything is coordinated and explained to the patient. And we can be hopefully that one-stop shop to coordinate everything amongst other folks. If it's something that can be discussed, over the phone or electronically, we do have that ability too. So sometimes that makes it a little easier to get a specialist's opinion.
I would say so. It makes it a lot easier if you've got those folks, in your pocket to be able to communicate with when necessary, and kind of get their take on what's happening with a patient. So I have to say, I'm very excited to hear about these services. I am excited to have them in the Mahoning Valley. I know that we talked about this already, Bill, but I'm going to shoot it back to you. We got about a minute left with our audience. Remind me how I can become a part of the Heyday family. What do I need to do to have your team come out to the house?
Well, the best thing is just to call our phone number, which is 330-223-7001.
Perfect.
If you're in the community, you go to any senior function, at some point you'll see me. And then you could shake my hand or whatever, we could talk. But yeah, I look forward to going out to, and especially again, if people are watching, if they're in a group, maybe it's a church group, and you have speakers on a regular basis, I'd be glad to, just call that same number. Perfect. And they can get a hold of me. So,
and they can learn a little bit more about the joys of Heyday. So
Yeah.
I have been so glad to have you both on the call with us today. Thank you for joining us for the show. Hopefully we can have you back later this year and you can give us an update on what's been going on with Heyday and any changes that might be. Yeah, we'd love to hear more.
Anytime.
We'd love to hear more. So to our audience, please take the time to learn a little bit more about Heyday Health, visit their website, give them a call, and get them out to the house. Until then, thank you, Bill. Thank you, Dr. Mehta. I hope you both have a great day, and I hope our audience has a great time until we join you next time.